Your heart works every second of every day. Shouldn't your supplements work just as hard? Introducing 3 powerhouse cardio support products from Protocol for Life Balance. Nattokinase, drawn from a centuries-old Japanese tradition. This remarkable enzyme helps maintain healthy blood flow and normal blood fluidity. Circulation you can count on naturally. Next, ubiquinol. This is the active form of CoQ10 your body actually uses, fueling cellular energy production, neutralizing harmful free radicals, and delivering superior absorption. And finally, Clinical Cardio 6. 6 powerful nutrients, 1 capsule, including L-carnitine to energize your heart, hawthorn, and Mega Natural BP grapeseed extract for healthy blood pressure, and MK7 to keep your arteries flexible. Comprehensive cardiovascular support, all in one. Protocol for Life Balance, science-based professional-grade products using ingredients backed by strong research. To order, go to drhoffman.com/protocol for life balance. That's drhoffman.com/protocol for life balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. It's our weekly Q&A with Leyla. And in part 1, I talked about what I did on my summer weekend, which is do a deep dive on the subject of glucosamine and brain health.
Yeah.
And so before we get to questions come to questions@drhoffman.net. What did you do on your summer weekend? You wrote a nice article, which is kind of an interesting take. Yeah.
And for those of you who are subscribers to the Intelligent Medicine newsletter, you probably got it in your inbox a day or two ago. And I wrote about musculoskeletal pain in perimenopause.
Oh, like achy shoulder,
or can't reach around the back to unhook the broad thing, carry the groceries is weird.
Yeah.
Getting dressed is achy now. It kind of hurts to get dressed,
What's
to get
up with
undressed.
that? Yeah.
What's going on? And it's been blamed on perimenopause, the transition to menopause.
Mm-hmm.
But there's a very interesting framework done in this article, insulin resistance screening in perimenopausal musculoskeletal care, of a framework, a really functional medicine informed framework.
Wow.
And
Nice.
what they're saying is during this transition in life, the declining estrogen, the hormonal variability, increased belly fat is something that often happens. A lot of women who will say, I was always a hip and thigh girl. I never had belly fat. Now I'm 40 something. I have belly fat. What's going on? It could be some evolving insulin resistance that's happening there. Whether it has to
Which happens in both men and women at midlife anyway.
That's true.
Right?
That's true. Yes. And that can, and emerging insulin resistance can lead to increased tendinopathy prevalence.
Wow.
It can cause persistent joint pain. And this is interesting, that even though you go do the PT or the tissue rehabilitation, whatever method or modality you're doing, that it may be short-lived. So what the claim is that there's a variable rehabilitation response because of the underlying insulin resistance.
Okay.
So I said, wow. So not only are we getting more carbohydrate intolerant as we get older, what I really believe is, okay, now it's been this many decades, I'm eating this many carbohydrates, and this is the impact it's having on me. That this is something that needs to be looked at.
Well, it's kind of interesting because I have a relative who is, around the age of menopause, and she's coming up with a lot of aches and pains. She has neck pain, and, the doctor says I could do an injection, but, we don't want to go there yet. And said, hey, why don't you, why don't you try like a really clean diet? I said, wow, this is like an orthopedist, who's like a neck specialist who's saying that. And so really along that theme, she got rid of the extraneous junk and is better. So
reducing inflammation.
I mean, because they did an MRI and they said, well, there is this and that and the other, because you're going to find some stuff if you look at the neck of somebody in their 50s. But it got better, and kudos to the orthopedist to say, I want to be really conservative here. I want to try really a trial of 6 weeks of clean diet. Gave her a Medrol dose pack, which is a steroid. If you really need to pull the trigger, take this as a steroid, but Try not to take it if you don't have to. Another thing is, I once heard a lecture from a Japanese lecturer about menopause. And what the Japanese lecturer said is it's kind of a cultural joke in America versus Japan. Is one of the signs of menopause in America is like, it's too hot in here. The women are fanning themselves, that kind of thing.
Yeah.
He says, that's not a thing in Japan. He says, that's not a thing in Japan. Why? Because they consume an enormous amount of soy. So they're getting a lot of soy estrogens. And
those phytoestrogens.
But he says, the cultural joke in Japan is sore shoulder. Ha, ha, ha. I have sore shoulder. It's the equivalent cultural joke to like, isn't it too hot in here? Because they don't get it into the diet is different. They still experience that musculoskeletal thing that has to do a little bit with sex hormones and estrogen and maybe a desiccating effect of lack of estrogen in the joints as well, vaginally as well, but, also in the joints. But, as you say, it's a reasonable strategy for people to undertake a dietary cleanup at menopause because, if you think it's just all about hormones, it's not. There's a lot going on at the time.
It's not. Yeah. So that's actually what I wrote about. And the musculoskeletal thing, just that it's making it more holistic. Physical therapy is wonderful. Physical therapy is a godsend, but sometimes it does. You can be rid of your symptoms. You can be done with physical therapy, but you may find after a period of time, a short honeymoon, that the pain comes back.
Yep.
Because again, we're talking about root cause. What may be the root cause or the thing that's exacerbating it or causing you not to heal as well? So that variability in the rehabilitation outcome is something.
Yep.
So it's interesting. I just found it interesting. It all comes down to what we're eating.
Hey, this is Q&A with Leyla. We're eventually going to get to questions, I assure you. But before we do that, let's allow one of our sponsors an opportunity to share important message with you. So here goes. Listen up, please.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening and thanks for supporting our sponsors because they are what make intelligent medicine a continuing free resource to you through their generous sponsorship and underwriting. And so now let's hear one of our questions or comments.
Yeah. From Louise. Louise says, Dr. Hoffman, I have a friend who's diabetic and has a nasty leg wound, which I suggested he get some hyperbaric oxygen to help facilitate healing. It's been going on since November. It heals, it reopens. Your guest gave me lots of great info that I could pass on to him. Apparently you interviewed somebody on podcast, Dr. Hoffman, huh?
Yep.
So he has a few other issues. So he's checking in with his doctors to see if he can do this. The good news is it'll be covered by insurance.
Yeah, that just mentioned that, hyperbaric oxygen is probably beneficial for a lot of things. It's beneficial for stroke rehab. It may be helpful for neurodegenerative diseases. But it may not be covered for that. It is covered for the bends if you're a diver, and you come up too fast and you get nitrogen bubbles in your muscles or your brain or your organs.
Yeah.
Decompression chambers. But it could be covered for poorly healing wounds. I think the insurance companies are going to be wary of it because the course of therapy is expensive. So you're going to have to all kinds of prior authorizations to get it. But I think it's a good way to go because you're really putting healing oxygen into the tissue. And also the bacteria that infect these wounds, they are anaerobic. They hate oxygen.
They can't really live in an
yeah.
oxygen environment, right? Yeah. Yeah. So, Louise, thank you for this very thoughtful question. She really appreciates all of your very diverse guests, Dr. Hoff.
I want to mention another thing on that, which is that recently, and you'll hear this podcast this week probably, if not next week, with Nathan Bryan, who's an expert on nitric oxide. And he makes a product with their sponsors. They make something called N101. And N101 is my favorite nitric oxide boosting supplement. It's a lozenge. I take it before workouts. And but he also makes some skin products. And he told me a fascinating story. I said, how did you get into skin products with nitric oxide? He said, well, his father became a paraplegic and in the 1980s. And he was a research scientist, and he was one of the world's leading experts on nitric oxide. And he thought, well, nitric oxide has circulatory enhancing properties and potentially healing properties. And so he thought of like how to deliver the nitric oxide to his father, who was developing decubitus ulcers. Because if you're paraplegic and you're paralyzed, you just sit and sit and sit. And, no matter how much they turn you around, you have no volition to move your legs, and you get like terrible sores on your hips and on your legs. And so he had something that was the size of a, tea saucer that they said, very poor likelihood of healing. And he said, well, let me apply my scientific knowledge. And he created some like a bandage that was saturated with nitric oxide inducing chemicals and applied it. And he said, darned if it didn't heal. So that was a dramatic illustration of the healing and regenerative properties of nitric oxide. And so he's developed a skincare line. He's also applied for a patent for a medical application because this is an unmet need. Is there so many patients, elderly patients, nursing home patients who have decubitus ulcers, poorly diabetics who have poor, and this some can result in amputation sometimes. And so he is really has done a lot of research on applying nitric oxide products to wounds for wound healing. So, maybe that's hyperbaric oxygen and the nitric oxide applications might be a good tandem treatment. So look into that.
Definitely. Wow. Louise, thank you for your question. Okay. Oh, this comes from Caroline. Hi, Dr. Hoffman. I loved hearing your interview with Dr. Judy Morgan. As a pet owner trying to buck the system and be organic and chemical free, it's great.
She's a holistic veterinarian, which I really love talking to these people because there's so much of an implication for human health. The stuff that works in animals so reveals insights about what would be beneficial for humans from the standpoint of diet, from the standpoint of natural products that the animals respond to, because they don't have a placebo effect. If I tell you, oh, I'm giving you curcumin, and you say, oh my goodness, so my joints feel better. Well, hey, you just spent, $20 on a bottle of curcumin, you got skin in the game, and there's a placebo effect and there's a belief.
Sure.
Animal doesn't know. And if the animal is better, something's really happening.
Right. And I would like to remind pet owners, that if you give your dog chocolate, that it's bad for your dog. If you give your dog, what is it, stevia or xylitol? It's really bad for your dog. Why are you ingesting this? Why are you ingesting some of the things? What? And I see pet owners.
I will quibble because there's something about they're very similar to us, but there's some pathways that they don't have. So there's xylitol. I can chew xylitol gum. In fact, I'm chewing some xylitol gum as we speak. We can process xylitol. For some reason, animals can't process xylitol, so they get all messed up
Sugar
with xylitol.
Alcohols, right. It's
chocolate,
not part of their
native diet,
canine diet.
You got to feed them paleo. Like, look at what animals in the wild eat and try and replicate that.
Right. And except when it comes to the true herbivores like rabbits or something like that, or apes or something. So it's all really interesting. So yeah, this is great. Okay. So yeah, it's good to take good care of your pet. I know there's pet insurance, all of that. I'm not a pet owner myself.
Mm-hmm.
Actually, I never have been. My mother was. They taught the dog to wipe its feet at the door before coming in.
Wow, that's pretty cool. Yeah.
Goodness. So, okay. Let's see here. We have, this is one from John. John says, loved your article. I'm a longtime program listener. I loved your article on doctors to avoid.
Okay.
Yeah. I think most important is that how can you find good doctors in our region? Because John says, I have prostate cancer. I'm into it a few years. I keep an eye on it. I went through 2 biopsies and the result is it's not aggressive both times. My PSA went up. I went for an MRI. They found a lesion. Now I'm going for a guided new biopsy with MRI data to target to see if anything is malignant.
Yeah.
Well, my prostate is Swiss cheese now.
Yeah.
I cannot believe all the biopsies do not spread cancer or agitate and inflame what is there.
Yeah.
I have an enlarged prostate. I'm 71. I'm feeling like a high billable customer with all the procedures.
Yeah.
Can I find a doctor that doesn't milk me like a cow?
Yeah. So it's controversial because, when it comes to prostate cancer, in order to determine the best type of therapy, they want to stage it. So they want to find out, A, do you have it? But not all prostate cancer is that aggressive. And, they can do imaging studies like MRIs, and they can now do urinary studies and other types of blood analysis. And they can do imaging studies where they do CT PET scans to see if it's spread around your body and there's all kinds of ways to look at it. And I can't really weigh in on this and say, were there too many biopsies? I mean, 3 sounds like a little overkill. And, you'd say, well, what's the big deal? Well, it's you have to go transrectally for these biopsies. So you have to kind of go with a needle, and there can be complications. I've talked to patients who said, I had my prostate biopsy, and then I went home and I sat on the toilet and I couldn't stop bleeding, from the penis. Voluminous blood was coming out. You can hemorrhage. It can have adverse effects on ejaculatory function, etc. It's, it's a traumatic procedure. So I can't comment on this individual instance. I think get a second opinion. Is there another way? Also, when one is older, there is also a question of, how aggressive should you treat prostate cancer? Because the prostate cancer might be very slow growing. And it might be that prostate cancer that kills you at 122, which is an age that you won't attain anyway. So I think urologists are getting better. I think there was a time where urologists were, at the drop of a hat, they wanted to do what they thought was the most definitive thing, but also, frankly, it was a procedure and they could charge for it. And they would do, a needle biopsy. And now the urologists that I know they'll just do it as a last resort if they really need that information. When you first have prostate cancer, it actually is probably important to get a needle biopsy because that is the way to establish what's called your Gleason score. And your Gleason score determines how much of your prostate is affected. Is it just like one little place, or is it all over your prostate? It also establishes how aggressive the cells appear. And so, okay, one and done, fine. Okay, we know you have prostate cancer. That should guide the therapy. But, keep doing it. I'm not sure I'm not privy to the rationale that your doctor has. But, coming back to that article, we talk about doctors who are overaggressive. We talk about doctors who are alarmists. We talk about doctors who are gaslighters, who try and delegitimize your complaints. There's all kinds of pathologies among doctors, just as there are among people. And so I started writing the article thinking that I would write, maybe 6 or 7, but I ended up with 20 different types of doctors to avoid.
Wow.
So we had to break it into 2 articles. We're serializing. This is the first drop last week. The second will drop this week. And
stay tuned for that.
So, I wrote a book, How to Talk to Your Doctor About Complementary Alternative Medicine, and I think it was around 2000, 2002.
Yeah.
And it was, that's over 20 years old. And the idea was to help guide people in that important conversation that they have with their doctors about, if they want to use natural care, how to navigate that difficult discussion.
Right. Yeah. And it shouldn't be a difficult discussion, but it's the predicament we're in. It's great to learn to be your own advocate as a patient or as a client of any practitioner. So these are the things to look for. Looking forward to part 2 of that article. Dr.
Indeed.
Hoffman. Yeah.
And now back to our question. Do we have any additional questions?
We have a question. Yes, we have a last question here from Jill. What's the latest on melatonin? Is it good or bad? I've always deemed it good with like cancer prevention benefits, among others. But are there cardiovascular risks? What say you?
I think I have a dim memory of an article that I wrote when the last scare about melatonin came out.
Yeah.
And I ultimately, I think it
was about heart failure. Melatonin and heart failure.
It was in the rear. It's in the rear view mirror because it never really panned out.
No, it didn't.
So I think that's really not a consideration. I think I take melatonin every night.
Yeah.
And I don't take it to sleep because I notice that if I forget my melatonin, if I'm on a trip or something or run out of it, I still sleep pretty well. So I don't really take it that much for sleep. I think it deepens my sleep and helps me to get to sleep sometimes, but melatonin's not really such a strong knockout pill. At least for me, it isn't. And I take it also because I think that as one ages, once melatonin drops, melatonin has an interesting property, which is that it is actually made in the mitochondria. Does mitochondria make melatonin? And melatonin may have a lot to do with important signaling and energy production within the mitochondria. So there's, I think there's a rationale for sustaining your melatonin, which declines as one ages.
Yeah.
Also,
taking care of your mitochondria so that you still make some.
And also helping your chronobiology. I think chronobiology is important. You can help that with a light exposure and the dark exposure. Make sure your room is dark when you sleep. Make sure you get sunlight in your eyes in the morning, especially, because that'll actually help to stimulate your own body's production of melatonin. I think there's some controversy about melatonin for children. It is thought that melatonin has some hormonal effects. That could be a positive when it comes to cancer because we're actually giving really high doses of melatonin to especially people with hormonal cancers like prostate cancer and breast cancer with higher doses than would be required for sleep. But interestingly, once you get past a certain threshold, it's not going to knock you out. People are taking 20, 40 of melatonin and they don't fall asleep at the switch, at the wheel.
Right. That sounds like more of a cancer dose, 20 milligrams or 40 milligrams.
Now,
for sleep, basically up to 5 milligrams for many people. But
the question is, do you want to give a small child melatonin because it might have an effect on their hormonal development? Because it does do something there. And the answer is that it is sometimes used in kids who really have a messed up chronobiology. And that's especially kids on the spectrum with neurodivergent or autism spectrum disease, and they have a terrible time with sleep. And sometimes parents find melatonin can be helpful, and then the small risk that it might affect their hormonal development is outweighed. A clue about melatonin and cancer comes from night shift nurses who have a much higher incidence of breast cancer.
yes,
And the notion is that they're exposed to artificial light all night. That
so they're not making any. They're not making any melatonin at all.
It suppresses their melatonin.
Yeah. We'll see more of a prevalence of cancer in shift workers when you're working all night when you should be sleeping, because melatonin is really only made in the dark. You could go home and sleep during the day. You could have your blackout curtains and all that. It's not quite the same.
Yeah.
It's just not quite the same. So I think melatonin is more effective or maybe better utilized at night when it's happening, and that's when we're supposed to be sleeping.
It's a potent antioxidant too, melatonin.
It is. Yeah.
So, I think melatonin is, in my opinion, not just something for occasional sleep problems.
Mm-hmm.
And if for sleep, it's actually among the weaker things that is for sleep, in my opinion.
Okay. As opposed to a shot of brandy or whiskey. Don't do that either. You'll wake up in the middle of the night.
Yeah. Oh, it's like
Don't do that.
I learned that from bitter experiences. And it's actually one of the reasons why I drink less, because it actually messes up the quality of my sleep. I mean, if I
absolutely does.
I'm on a kind of a one drink max when I go out. I like to socialize, and I'll have a cocktail. But if I have that, cocktail, additional glass of wine, or like 2 glasses of beer, I'll fall asleep because I'll be like, it's a knockout. But I will have a middle of the night wake up.
Right.
That
Alcohol does rob our sleep. It causes low blood sugar during the night. That's the wake up.
Yeah.
Cortisol springs out. That's part of the wake up too.
It's you're withdrawing from the sedation, and you get a rebound. So
alcohol is not great for sleep. Absolutely.
No, it messes with sleep. So yeah.
And speaking of melatonin, don't forget that you can shop hundreds of curated vetted supplements in Dr. Hoffman's full script dispensary. We stock only the highest quality supplements, some of which are very hard to find elsewhere, the very same supplements he takes. And I do too. So go to drhoffmanstore.com. That's drhoffmanstore.com. You get fast and free shipping, and it's all good.
Maybe we should run a sale on glucosamine because
absolutely.
After the glucosamine scare, that's where we get our supplements. And as a matter of fact, I'm waiting for my delivery. Let me check. I could check my phone because do I have my delivery downstairs? Yeah. Okay. Maybe it's there because I usually I put in for the fast delivery option, which is free, and it's 1 to 3 days. And man, I am impressed with their quick turnaround.
Yeah.
I just
really very good.
Ran out of my whey protein yesterday, and I ordered some more. Yeah.
There you go. Yeah. Thank you, everybody. Thanks, Dr. Hoffman. And remember, questions at drhoffman.net. We love your questions.
And comments. Thanks, Leyla. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muden, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.